Hi, I'm Ahicking, and today I'm going to talk to you about social anxiety disorder, the symptoms, the etiology, tools for assessment, treatment options, and treatment outcome measurements. Social anxiety disorder, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, encompasses an individual being fearful, anxious, or avoidant regarding social interactions or situations which may involve scrutiny. To be diagnosed with social anxiety disorder, the Diagnostic and Statistical Manual outlines an individual must present with the following symptoms, and the symptoms must not be attributed to other mental disorders, substance use, or underlying medical conditions. The first criterion, criteria A, is that an individual must present with as having a distinct fear or anxiety about one or more social situations which may involve scrutiny. These situations, for example, could be meeting unfamiliar individuals or being observed whilst performing on a stage. It is also important to note that for children, the anxiety must be present when interacting with peers, not just when interacting with adults. Criteria B is that the individual has worries they will show symptoms of anxiety or that they will act in a way that will be negatively viewed in social situations by others. They may be worried they'll be humiliated or embarrassed. Following these criteria, the criteria C to G outline social situations nearly always bring on fear or anxiety. Social situations are endured with great fear and anxiety or are avoided completely to prevent the fear and anxiety. The fear and anxiety is out of proportion to the actual threat posed by the situation, and that the symptoms are persistent, typically lasting for 6 months or longer, and that the symptoms cause clinically significant distress or impairment in important areas of functioning. The last three criteria outlined in the Diagnostic and Statistical Manual to diagnose social anxiety disorder relate to attributing factors discussed previously, that being symptoms are not better explained by substance abuse, for example, drug abuse or medication abuse, another mental disorder such as panic disorder, or another medical condition such as Parkinson's disease. The onset of social anxiety disorder generally begins in the life period of early to late adolescence, although social anxiety disorder presents itself sometimes in younger children. The prevalence of social anxiety disorder is generally found to increase from childhood through to adolescence, and social anxiety disorder tends to have a chronic course and will not improve without treatment. Review of literature has indicated onset of social anxiety disorder may be influenced by a range of biological, psychological, and environmental factors. For example, an environmental influence of parental influence, parents modeling behaviours of apprehension in social situations, leading to less positive social interactions for children and leading to them modeling this in their lives. Genetics also playing a role in the hereditability of social anxiety disorder. Temperamental traits such as behavioral inhibition, which relates to behaviors tending to show such as fear, avoidance, and withdrawal when in new situations or when new objects are present. So behavioral inhibition may act as a precursor to developing social anxiety disorder, as all those symptoms are actually linked to social anxiety disorder as discussed in the Diagnostic and Statistical Manual of Mental Disorders. Whilst there are many factors leading to the causation of social anxiety disorder, there are also factors of prevention, including parental influences, modelling of good social situations leading to positive social interactions, and the children modelling the positive interactions in their own lives. These are just a few of many factors influencing the course, cause, and prevention of social anxiety disorder. While I briefly touched on them, it is critical to look into an individual's whole situation through the biopsychosocial lens, which will help to gain a better understanding of the personal situation of the presenting client, which will allow for personalised treatment with the aim of the best possible outcome for each individual. In order to do this, we need to begin to look at assessment using assessment tools. There have been many tools developed to assist professionals in assessment of social anxiety disorder, from self-report measures to clinically administered structured interviews. A brief few self-report measures I will touch on today are the social phobia inventory, the mini social phobia inventory, and the social phobia and anxiety inventory. The social phobia inventory screening for social anxiety disorder is a 17-item self-report scale and has been found to be useful in distinguishing between individuals with social anxiety disorder and the non-clinical population. Questions on the social phobia inventory include items such as fear of embarrassment causes me to avoid doing things or speaking to people, or I avoid activities in which I am the center of attention. The social phobia inventory uses a 5-point Likert scale, where 0 means the individual is not at all likely to be bothered by the symptom in the past week, and 4 is the individual is extremely likely to have been bothered by the symptom in the past week. It has been presented that the cutoff score is 19 to distinguish between individuals who present with social anxiety disorder and those that don't. The social phobia inventory is designed to measure 3 symptom dimensions, one being fear, the other being avoidance, and the last one being physiological arousal. Derived from the social phobia inventory is the mini social phobia inventory. This is comprised of 3 items from the social phobia inventory that produce the greatest statistically significant difference between those that present with social anxiety disorder and those that did not. With its quick administration times and the ability to differentiate between clinical and non-clinical populations, the mini social phobia inventory is a great tool for initial screening of social anxiety disorder. The last assessment tool I will discuss today is the 45-item self-report social phobia and anxiety inventory, which contains both a social phobia and an agoraphobia scale. The social phobia and anxiety inventory was developed to assess social phobia and in particular specific somatic symptoms, cognitions, and behaviours across a range of potentially anxiety or fear-producing situations. The items on the social phobia and anxiety inventory are rated on a 7-point Likert scale, 1 being they have never experienced the symptom, or 7 being they always experience the symptom. Some example questions are, I experience troubling thoughts when I am in a social setting, and I experience sweating in social situations. The time to complete the social phobia and anxiety inventory is around 15 to 20 minutes. So there has also been shorter versions created and also child-friendly versions. After diagnosis of social anxiety disorder, we look to treatments. The main treatments used for social anxiety disorder include psychosocial treatments and pharmacological treatments. Psychosocial treatments have had much focus placed on cognitive behavioural therapy. Within cognitive behavioural therapy, there are treatments which are comprised of various combinations of exposure therapy, cognitive restructuring, applied relaxation training, and social skills training. Exposure therapy involves individuals affected by social anxiety disorder being continuously exposed to situations, whether virtually, imagined, or in real life, until the anxiety in those situations decreases. Cognitive restructuring is used to have the individual identify the negative thoughts which occur prior to the situation, which brings on the anxiety, and teaches them to challenge these thoughts and replace them with more adaptive thinking patterns. There are a few cognitive behavioural intervention programs which incorporate a variety of these cognitive behavioural therapy treatments, one being group cognitive behavioural therapy and the other being social effectiveness therapy. Social effectiveness therapy has also been developed for children and adolescents. Both intervention programs focus on group interactions with a mixture of cognitive behavioural therapy components over a period of time or sessions to help reduce the impact of social anxiety disorder and what it places or the stresses and anxieties on the individual. A few other forms of treatment are acceptance and commitment therapy and mindfulness. They may be implemented to treat social anxiety disorder as well. Focus of these treatment illuminates that the individual presenting with social anxiety disorder needs to accept the negative thoughts they are having and release those thoughts without rumination over those thoughts to avoid becoming anxious and worked up. Finally, another empirically supported treatment is pharmacological types, and the most common pharmaceutical administered to treat social anxiety disorder is selective serotonin reuptake inhibitors. However, the use of these selective serotonin reuptake inhibitors may produce side effects such as fatigue, sleep issues, agitation, and restlessness, to name a few. Once treatment has occurred, it is highly beneficial to measure the outcomes of the said treatment when dealing with social anxiety disorder to see how effective the treatment has been. As discussed previously, there are many self-report and self-rating scales to help with the diagnosis and measurement of social anxiety disorder. The use of these tools before implementing treatment as an intervention not only provides a strong basis to develop hypothesis and diagnosis of social anxiety disorder, but also doubles up as they provide us a baseline measure to further compare with during and after treatment has been administered. Using the social phobia inventory to measure pre and post treatments scores for social anxiety disorder appears to be reliable and a sensitive option following cognitive behavioral therapy. Studies such as Anthony and colleagues conducted in 2006 provide evidence that solid effect sizes between the pre-treatment and post-treatment social phobia inventory scores validate the social phobia inventory works well as a treatment outcome measurement. Review of the literature also presents the social phobia and anxiety inventory, and the social phobia and anxiety inventory for children are both reliable and sensitive measures to determine treatment outcomes for social anxiety disorder. Talbot and Associates in 2012 present the social phobia and anxiety inventory for children captures the positive changes after intervention treatments for social anxiety disorders in children, and other similar studies have replicated these findings. In conclusion, both tools for assessment purposes are effective in measuring the outcomes of social anxiety disorder treatments. I hope I have provided you today with a brief outline of the symptoms, etiology, tools of assessment, and treatment options and treatment outcome measurements for social anxiety disorder. It has been my pleasure talking to you in regarding social anxiety disorder, and I wish you have a great day. Thank you.